senior projects, so basically you guys are all helping me graduate. So, and this will be broadcasted in case you guys wanted to share with your friends on Headlines, which is our YouTube channel. So I'm just going to get started. I'm going to go down the row and introduce everybody. It might be a little bit out of order, but I'm going to do it based off of your packet. So if you guys want to follow along there. So first we have Claudia Gibbons. So Claudia works in emergency medicine at Middlesex Health. In her ER, they have different zones or sections. And as a physician's assistant, each zone is staffed by one physician and one physician's assistant on one nurse practitioner. So the team of 2 providers covers each zone and works as a team to take care of patients for each zone. So if you guys can, that's just the first page on your paper, if you guys just want to read a little more about her. But yeah, we have some big questions that will be coming up, and then at the end you guys can ask whatever questions you guys would like or talk to them individually. Next we have Anne Marie. Anne Marie is a clinical pharmacist at Dale New Haven Health Home Infusion Pharmacy. And as a home infusion pharmacist, she dispenses IV medications for patients to administer or have administered in the comfort of their own homes. So this is a little bit different from your regular retail pharmacist, which you might see in like a CVS. But Anne Marie will go a little bit more into depth with that, answering some of her questions and after. So that's exciting, a different career path. Next, we have Kate and Michael. So first, Coach Kate is also our soccer coach here at Woodlands. So she is a registered nurse for Hartford Hospital, where direct patient care is her main role, where she takes care of patients who have had injuries, strokes, and surgery for brain tumors or spinal fusions mostly. And the majority of her patients are critically ill, so her role is to manage these patients, which can require a lot of tedious processes. Next we have Michael, and he is a colorectal surgeon for Hartford Hospital. His main role at the hospital is to care for patients with colorectal problems, while also caring for patients with emergency general surgery issues like appendicitis, gallbladder issues, infections, and emergency intestinal issues. So next we have Mrs. Messina. This is, as most of you guys know, Nate's mom. Mrs. Messina is a physical therapist and has worked for the past 12 years in the home care setting, but she also has experience in acute care, which is in the hospital, and in skilled nursing facilities. This also includes both short-term rehab patients and long-term care patients, so she has a wide range of examples there with physical therapy. And then next we have Gabriella Soriano, who is a UConn student. She is a current senior at UConn, double majoring in molecular biology and biophysics. She also is taking part in undergraduate research that uses biophysical and biochemical techniques to study mutations of patients with Hay-Fountain syndrome, which is a novel and rare neurodevelopmental disorder. So after college, I'm sure she'll speak a little bit about this, but she is planning on getting her PhD in biomedical sciences, which is very impressive. And then finally, we have Giovanna Gordon. So Giovanna is a current UConn student who is receiving her bachelor's degree in molecular and cell biology in order to pursue nursing. So she currently works as an MIT and pediatric emergency room technician, and after college, she is planning on getting her bachelor's BS in nursing program, which is an accelerated program. So yeah, so that's just a little introduction. So now I have some prepared questions, just that I'm going to go over, and then after you guys can ask whatever you guys would like. So our first question is, what do you guys want to know about a career in the medical field? Or what do you want students to know about a career in the medical field? So first we have Giovanna answering this one.
Okay, so what drew me to a career in nursing is just how diverse it can be. You can really go in a lot of different paths, and it's just very versatile.
And then we have Kate.
I actually, when I was in high school, I didn't know what I wanted to do. I knew that I wanted to play soccer in college, and where I chose had a really good nursing program, so I kind of just fell into it. But I knew I liked science, and yeah, like she had said, there's a lot of different options in nursing. So if you don't know exactly what you want to do, it's kind of a good place to start, and then you can pinpoint where you want to go from there.
Great, and then we have Michael.
You know, I always felt I wanted to become a doctor. It's a long process. There's at least 4 years of undergrad, pre-med, and then medical school. And then outside of medical school, you have to go to residency. And in residency, then you kind of, you know, finish up and do all your training, and then you finally become a doctor. And it's very rewarding, taking care of patients at their sickest times. And it's a long, drawn-out process, and your life is definitely on hold for a while, but it's very fulfilling and rewarding. And I would only want to become a fireman instead of this.
And then our next question is, what were some obstacles that you have faced throughout your education and career, and how have you overcome them? So first we have Gabby answering this question.
So I graduated high school in 2020. I'm actually from Ansonia, so not too far from here. But my first year of college was all online at home, so that definitely was a challenge. And because of that, I felt like I was kind of behind in terms of like everything, like meeting new people. And I knew coming into UConn, and one of the reasons why I chose UConn is because it's very research oriented, that I wanted to get lab experience early on. And so that was kind of a challenge, feeling that I was behind, which I realize now was not the case at all. And knowing that, or once you realize college is all about you and finding your own path and your own journey, you don't have to compare yourself to others, because that'll only make you feel like you're behind in some aspects. And a lot of people come into college thinking and knowing what they want to do. And personally, I had an idea, but not really. Like, the medical field is so vast. So it did take some time to pinpoint that I wanted to get into research. But once you, or little by little, like, you'll start knowing exactly what you like, but also what you don't like. And little by little, you'll know and find your own path and right path. And that's how kind of like you overcome that.
Yeah, I feel like I'm in a lot of the same boat as you going into college. I'm majoring in biomedical engineering, but I've also explored laboratory experience, so it's definitely good to hear that. And then next we have Anne-Marie.
So I went to UConn for my undergraduate before I went to pharmacy school. The unique thing about pharmacy is that you don't have to have a bachelor's in order to go to pharmacy school. So I was doing my undergraduate classes, and then after my 2 years, I applied to pharmacy school. And I actually didn't get accepted to pharmacy school at that time. So I kind of had to take a step back and look at what I was doing and really decide where I wanted to go and what I wanted to do. So after doing an extra year at UConn, I then applied to pharmacy school, and I went on to complete my 4 years at pharmacy school and become a pharmacist. So you may experience obstacles and challenges, and you just have to keep pushing along.
So for me, I actually didn't speak English until I was about 12, 13. So when I started looking into careers, I didn't have like family, friends, anybody that was in the medical field. And so for me, the first challenge was really getting into a hospital. And so I think the only thing I would say to that is that exactly like this type of environment is what I did. And a lot of Googling and networking is important, especially when you don't really know what you want or what you like, because the more you hear, the more you like ask to shadow somebody, you actually get to see what you could be doing as a nurse or pharmacist or surgeon. So just the networking, the connection is the first obstacle. And then I think just finding balance once you get to your profession, especially in the ED during COVID. I think it was like the mental health, burden and being like physically tired, and the emotional aspect of things. It's always still like a work in progress for me and probably for most of us, but I think your generation probably talks about mental health more than mine and previous generations, and so I think that's an obstacle that we can probably all, in all of our careers, probably, continue to work at.
And our next question is, as a high school/college student, did you always have an idea of what you wanted to pursue, and if not, what were some other careers that you had in mind? So I know some people already touched on this. So for this question, I have Mrs. Messina.
When I was in your position, spring of my senior year, I knew I had loved sciences all through high school, didn't love the math quite as much, but when you're a kid that likes the math and sciences, they kind of point you in one direction back then. So I was applying to colleges for engineering, biology, and PT. Didn't really know which I wanted to do. Even at this point, like March, when I was ready to pick a school, I was still a little bit lost. I had done some shadowing and some, I guess you'd call it, I was an aide in a clinic. So I'd done some shadowing in PT clinics. I had done a little bit of shadowing in labs. And I was accepted to schools for all of those majors. So I went to acceptance students days, and I remember sitting there with one of my best friends at a very good engineering school, thinking like all the people around me in this big auditorium are eating this up. They love everything that this professor is saying. They're so excited to be here, and I'm just looking, I'm like, these are not my people. Like, this is not where I'm meant to be. So that was a quick pivot from the engineering world. As soon as I sat down at like the accepted students day for the physical therapy students, I realized that was my place. And I thought back to some of the shadowing I had done in clinics. I tried out a few different settings. So I had been in like an outpatient clinic. I wanted to get my foot into, see what it looked like in a hospital setting. And that's one of the things I can really say helped point me in the right direction. With the biology major, I didn't really understand what it would look like to be in a lab. I needed a job where I knew, okay, I'm going to school for physical therapy, I'm going to be a physical therapist. Like, I just couldn't wrap my brain around sort of that abstract concept of, well, what am I going to do in a lab? Who's going to point me in what direction? I think it's a lot different now. There's a lot more opportunities to see that before you jump right in. But I would say, if you have any interest in any of the medical fields, get yourself out there and talk to people who are in the different fields, because that really pointed me in the right direction.
Then I have a micro-quiz question.
So I always was between being a doctor and a firefighter. So in actually college, I actually was involved in a student force. I was a volunteer fireman. It was pretty awesome, and I did love it. But I also was in pre-med, I also worked in a lab, so I was pretty busy with things. And the more I did the volunteer firefighting, I got my EMT, and then I drove along the ambulance with some of the paramedic firefighters, and that was pretty cool. And I always thought I wanted more, and if I ever want to be a fireman, I want to be a big city fighting fires. And I'm from Boston, so I wanted to go back and be a Boston fireman. It was actually very difficult to become a Boston fireman at that time. It actually became easier for me to start looking at medical schools. And it was very competitive, and I didn't really have any sort of in with the fire department in Boston. So I chose the route of going into medicine, and I don't regret it. And I do agree you should get exposure early. The EMT was definitely kind of got me at least around the hospital, you know, transporting patients there and things like that. I didn't really know what I was doing, but it was fun, and I don't regret what I do now, and maybe I can become a volunteer in some small town around here. Oh, okay.
I just have a quick follow-up question for you.
Sure.
So during the time when you were balancing maybe volunteering at the fire department and exploring pre-med or going to school, did you find that challenging at all?
Yeah, it was tough. Yeah, because, you know, it's college, you like to have a life outside of school and things, and I think you just have to stay dedicated and really, you know, and diligent if you know, want to pursue your career. You know, you have to understand that there's playtime and work time, and I was pretty good at kind of balancing both. And pre-med is, you know, of course, difficult, and there were definitely some trying times and things like that, but you have to, if this is what you want, you have to kind of, you know, understand that it's a long process, but, you know, if this is what you foresee yourself being, then, you know, it'll be a, you know, great road at the end of this, and it's excellent. And now for pre-med, you just have to take the classes, and you can major in anything now, actually, to get into medical school. It used to be very science-oriented. I was a chemistry major, and I worked with pipettes and stuff, and you would never do that today. But Now you can be arts, liberal arts, all sorts of different majors go into medical school now because they're looking for more of a well-balanced person in medical school. But it was hard, and, you know, it was all worth it in the end.
And Kate, same question for you.
Sure, so my story is actually probably pretty bad because I really just kind of fell
It's not as good as mine.
No, not nearly. I kind of fell into nursing. I really didn't have any, I had always said I wanted to be an attorney when I was in high school, especially my first 2 years. I did like business law and those classes here.
You sure know how to argue.
And I basically didn't want to go to school for that length of time because I knew it was going to be a long length of time. So then I decided I didn't want to be an attorney anymore. And then what kind of drove me to pick where I went was more that I knew I wanted to play soccer at the next level, no matter what that level looked like. So the school I ended up picking for soccer had a great nursing major, and I was like, you know what, sure, this sounds great. I didn't really shadow nurses. I really didn't look into it very far. I just kind of figured I'd figure it out as I went along. And it worked out great. I like being a nurse. It was definitely the right profession for me. It's given me a lot of flexibility in the fact that I can coach and I can work. And I don't think there's many professions where you get to be able to do both. It's nice that you only do 3 days a week if you're full-time. If you're part-time, it's only 2. If you're per diem, it's even less. So,
Are you trying to have them work less?
yeah, I am. No, I'm just saying nursing is an easy way to balance life outside of work and still work, because you're not in the hospital 5 days a week or 6 days a week if you're in the hospital at all. It's a 12-hour shift, it's 3 days, and then afterwards you get 4 days off to recover from whatever you've seen in that time. And like I said, for me, one of my outlets is coaching. I've been super fortunate that I've been able to do it for almost a decade while being a nurse. And I wouldn't trade what I chose because it gave me the ability to coach. And I think that that's been really important to me in keeping my work is hard, nursing's hard, healthcare is hard. You see really sad things on a daily basis, and you see a lot of things you wish you could help change that you can't. And for me, my outlet was being able to coach on the days that I had tough days. Because coming here and seeing the kids and everything, as much as I might complain, it really helped me and my mental health in a lot of different ways, just being outside with them. So again, nursing allowed me flexibility that I don't know I would have had I chosen a different route.
Yeah, definitely. So Gabby and Giovanna, if you guys want to, with the same question, I know that you two are both pursuing one molecular biology and going into nursing. I was just wondering if you guys had any other ideas when looking into this major, if you guys had any other careers that you might have thought about or been interested in.
Yeah, so initially, I went to a magnet school in New Haven, where it was healthcare focused, and I also had my first lab experience in high school, so coming into college, I wasn't sure if I wanted to go the pre-med route or the research route, and honestly, that's something that I struggled with, all throughout college, figuring out what to do, and ultimately, I guess, what made me decide that research was right for me is because I'm very passionate about STEM, and I think more so, more than a clinical setting, I'm more interested in learning why disease happens and ways that it could potentially be treated in the future. And so that is something that I could answer more and get more immersed by in a research setting. So that's how I ended up choosing that route. But yeah, I did consider the pre-med route, and if that's, I know a lot of people are in that boat, but I think what everyone is saying here, definitely try things, and you'll see what you like, what you don't like. For example, I do my research at UConn Hill, where it's also the medical school, so I'm constantly surrounded by doctors and medical students, and also research. And I've also done a fair share of clinical experience, and you just have a feeling okay, I'm meant to be here, or no, I'm not meant to be here, I don't want to do this. So that's kind of how I'm in this path now.
So for me, I went into UConn as an allied health major, not really sure what I wanted to do. And I switched over to MCB, molecular cell bio, because I thought I wanted to do research. And I had one day in the lab, and I just really did not like it. It was not for me. And then I decided to go and pursue like more clinical outlets. So I became an EMT. I work as an ER technician at Children's, and I really just found that I loved the clinical side of things. I loved working with nurses. I loved the emergency aspect of it, and that for me is what really pushed me to like go towards nursing.
This question is actually really similar. So it's, if there was any other healthcare career that you could have, what would it be and why? So this one's for Claudia.
This one's a hard one for me. I think being a PA, I think it was, like I said, the right decision for me. I was thinking about this last night. So as a PA, so you do the undergrad 4 years and 3 years of PA school. They usually require like a couple thousand hours of clinical hours before you get to PA school. So a lot of us have had some type of entry-level job. You know, my classmates were paramedics, dental hygienists, dietitians. I was an EMT. We had like a Navy SEAL corpsman, you know, so many years sometimes they just do a year of EMT. And so once you finish PA school, you actually can do fellowships as well, a year or two fellowships. So if you really want to go into trauma or critical care or surgery, you can do a year of just surgery training. But once you become a PA, you can actually switch specialties to some degree. So you can, you know, I've considered going into critical care or surgery sometimes, and so I can think of some specialties I would want to do. I don't know if I would, like if I could be anything. I just learned what a midwife is a few years ago. Midwives are essentially like, you know, like PAs or nurse practitioners of just women's health, like OBGYN. So I believe they go to, if you're like a certified nurse midwife, you might know this more, you go to actual nursing school and then you go to midwifery school. There are some that I think call themselves midwives but don't have that training, but and they focus on like women's health from teenage years until they deliver babies in the hospital, and they do post-delivery care and just general gynecology things. And I didn't know that existed until literally like 3 or 4 years ago. And I think that's, you know, a really neat, focused clinician, like a job. And I think that would be probably not for everyone, but.
So our next one is, this switches topics a little bit. So tell a story, it can be funny or serious, about your job that clearly defines what you do and why you do it. So Mrs. Messina, this one's for you.
I suspect a lot of you, a lot of you are probably familiar with physical therapy in maybe an outpatient setting. I know a few of you have gone through surgeries and therapy yourselves. So when people think PT, that's kind of where their head automatically goes. That's where I thought I was going, but my first job ended up in short-term rehab with post-op patients, and I've kind of gravitated toward that for the remainder of my career. And you can't work in healthcare without having sad stories, funny stories. I mean, you could write books on it, I'm sure. But what has kept me in sort of the population that I like to work with, it's not like rehabbing an athlete who's super motivated. You know, they came into you, you had an injury, you're rehabbing and getting them back on the field or the court or whatever it may be. The population I work with isn't always motivated. They might be dealing with like a chronic illness. It could be something acute. Maybe they went into the hospital for pneumonia, and so it's kind of being the cheerleader as much as the clinician who knows, you know, this person needs to be doing these exercises this many times to get them stronger. It's really being the cheerleader and keeping people in their setting as long as they can be home, whether it's, you know, staying in the home. I've had some patients who all they really wanted to work on was walking far enough so that they could go to church with their family on Sunday if that was something important. So, you know what, maybe we're not working toward other things, but we're really building up their endurance. I had one patient who was rehabbing after a broken hip. She lived independently, family members close by, but they weren't there all the time. She was still driving, shopping, doing everything herself up to her injury. And one of the things she really wanted was to be able to walk her dog and ride her horse. She was 85 years old and still going to the gym, still walking her dog, and some of the things we worked on didn't look like normal exercises you would see somebody doing at the gym, but it was focused specifically on, okay, we need to get her able to climb up onto her horse. And I find that helping people do those things that are meaningful in their lives is really what keeps me working in the settings that I work in now.
So we're going through these questions a little bit quicker than I was expecting. So if anybody else wants to touch on that question about telling a story when you're serious about your job, then we'll go back to any other questions, but we'll move on. Did you have any more? Okay. So this next one is, would you recommend your job or major to somebody, and what about it do you like the most? So I can encourage this one.
I would recommend my job to anybody who's interested in going to pharmacy school. What I do is really unique in pharmacy, so you have a lot of different types of pharmacists. You have pharmacists, like Abby said, that work in your CVS and your Walgreens, and I've done that, didn't really like it. And then there were pharmacists that work in hospitals, and they do that type of pharmacy within the hospital. And then I have a really unique job in pharmacy where I work to help people who don't require hospital level care get the IV medications that they need outside of the hospital. So if you needed an IV medication for 6 weeks, but you only had to be in the hospital for 1 week, we could set you up with those 5 weeks at home. And so a lot of my job is teaching people how to do that themselves and getting them involved in their own care and wanting to do it correctly and wanting to stay on track with it. And it's a really unique job where I work really closely with other healthcare providers, but I work really closely with patients also. And keeping them motivated and wanting to get better and out of the hospital is a really rewarding career. Did I answer that question? Yeah. Okay. I forgot the question as I was talking.
Okay, so next we have Gabby.
So I'll talk about, so my major is biology. It's a structural biology and biophysics, so I would recommend it for anyone who's interested in learning about the very nitty-gritty of biology. So like, especially proteins, like their structure and their dynamics and their interactions with other cells, and with other proteins and cells and stuff. It's more so like biochemistry. If you want to go to UConn, it's a cool major. In terms of research, I also recommend that major and also just molecular bio because it does give you a lot of exposure to the theory behind the methods and also methodology and just background stuff that you need to know. It's definitely not for everyone. So in the lab, it can be very frustrating because a lot of the times you're dedicating a significant amount of time to something and then you don't get the right results, and it could be frustrating, but at the end when you do get the right results and you take a look at the bigger picture and realize like why you're doing it, then it's extremely gratifying and rewarding because you realize that you could be making a difference. You could be helping to cure someone, whether it be from a rare disease, which is what I study, or something more common like cancer. You can contribute to future treatment or understand why it happens in the first place, and I think that's really rewarding. I think it's equally as important to try it out, to know that you don't like it, because then it could lead you to a different path and really see what you like and what you don't like. So I think that everyone, whether like you're in a STEM field or even like social science like psychology, sociology, or even like business, definitely like having your foot into some sort of research is could, I mean, lead you to where you want to go, whether you want to pursue it or not.
I would agree with the MCB major at UConn. It's just like, it's a really good major that opens up a lot of doors for you. It hits a lot of the prereqs for medical school, for PA school, nursing. Nursing's its own major too, if you just want to go into nursing as an undergrad. I'm going after I graduate with my bachelor's, but yeah, it's a great one to start with too if you know for sure that that's something you're interested in. But I definitely would recommend nursing to anyone who's very passionate about helping people or interested in healthcare. Again, like I said before, it's just like a very diverse field that allows you to move around and really find what you like to do. And I think what I will like most about the nursing career is developing relationships with your patients. A lot of times it's on like their worst day, so it's nice to like be there for them and try to help them through that time.
Okay, and with that same question, I'm gonna ask Katie.
Sure.
Only repeat it.
Yeah.
It is, would you recommend your job or major to somebody, and what about it to their teams?
Yeah, I mean, I definitely would. And the thing is with nursing is it is really diverse. And once you go into nursing, you can go back to school and you can get your APRN if you want to be a nurse practitioner. You can go back to anesthesia school and be a certified nurse anesthetist, which is somebody who delivers anesthesia on a little bit of a lesser level than an anesthesiologist. But instead of doing, like 12 years of schooling, you can do it in, it's now 3 years of school after nursing, so it's 7 years. You can go back to school and get your PA if you want. The other thing that's kind of transitioning in the nursing career is there's a lot of jobs from home now. A lot of stuff has become remote, so if you want to go into that field but you maybe don't want to be at the bedside, you don't have to be. There's a lot of nurses who now work in bed management, which is like some subsection at Hartford Hospital, and they do a lot of placing patients where they're supposed to go. There's some hospitals that have a position where you're basically going to like rapid responses, which is when a patient gets acutely sick, or where you're going to codes all the time. There's even a portion of nursing where you just put in IVs. So there's so many different things you can do, and if, like blood, some people say they don't want to go into it because they don't like blood, they don't like needles. There's a lot of different avenues that you can go down without having to deal with blood or needles. And yeah, again, the flexibility of it is what I really liked. I like being at the bedside. I take care of acutely ill patients. A lot of them have really terrible head injuries. They're on breathing tubes, they're on medicine to make them asleep, they're on medicine to control their blood pressure. And even though I might not be the physician at the bedside making decisions, I still am responsible for telling the physician if there's a change in their status or if their neuro exam changes, because very small changes can lead to very bad outcomes. And so you have to kind of be very aware of what's going on when you're at work for those 12 hours. But when I leave work, I'm able to kind of leave that behind me. I don't necessarily take everything home with me. And I don't think every career in healthcare you can say that about. I think, especially if you are working from home, obviously you're taking your work home. But being able to kind of know that I'm handing my patient off to somebody who's just as capable leaves me with, a peace of mind when I leave the bedside.
Everyone here needs to become a colorectal surgeon.
There's not enough.
We need more. No, it's a great field. I see patients with just anorectal issues like hemorrhoids and things like that. And then I see patients with colon cancer, and we remove their colon cancer and they're cured from it. And then inflammatory bowel disease with Crohn's, also with colitis. And it's just, it's a great rewarding practice. And I do colonoscopies, I do small things, I do big surgeries like colon cancers and inflammatory bowel disease. So it's just a great breadth of different, like every day I have different things, and it's just a great rewarding practice in surgery, it really is. And then I also do some emergency general surgery and get called in at 2 a.m. and take out dead intestines and things like that. So it's really cool, and I see patients at their most trying times, and you get some great reward when they do recover and do very well. And I actually did do a trauma fellowship in Boston, and trauma surgery isn't for me. I like more focused in what I'm going to be doing, but it's a long, drawn-out thing, surgery, and it's 5 years of residency, so I worked 80 to 120 hours for 5 years. Show a lot for that. I do bring my work home at times. That was a shock to me, her comment. But medical school is great. That's 4 years. It's pretty planned out. But residency, at least if you want to go in the surgical fields, it's pretty daunting and it's extremely rewarding. And it probably was actually the best 5 years of my life, actually, even though I worked over 100 hours a week. The camaraderie I have with my other residents and chief residents that I still talk to this day is going through that. It's like you've had a bond that you've been through almost like just a very difficult time. I'm not going to say war. No. That would be weird. But that's about it for that. Now I'm rambling like I usually do.
And then with that same question, Mrs. Messina, let me repeat it.
Yep. We all go off on tangents.
Yeah, it's so true.
Would you recommend your job or major to somebody? What about it do you like the most?
I would say yes, but know what you're getting into. Some of my therapy friends and I, we half joke but half complain. Going into physical therapy, unless you want to own a clinic, be a manager, climb to the tippity top of your field. Like if you want to be a clinician in a clinic, there's a ceiling for salary. I mean, I know a lot of kids are looking at jobs because they know what they want to make, what kind of lifestyle they want to have coming out of school. I feel like in the therapy world, there is a ceiling that you'll probably meet in the first 10 years. But I'm not in it to be a manager, to run a clinic, to own a clinic. What I do, and any of you who've ever been involved in therapy, like you can see how rewarding it is. You take a kid who's injured on the field, and however many months later, they're rehabbed, and they're back doing what they want. Or, I take my lady who all she wanted after breaking her hip was to be able to ride her horse. So we do the exercises, we get her strength, we get her mobility, and she's back riding up and down Rimmon Hill on her horse. So I would say from my standpoint, I've loved, I know Kate touched on it, like the flexibility of a career in physical therapy. If you log on to any job site right now, I mean, there are jobs everywhere. I mean, just in Connecticut, but across the country. And you could be working in an outpatient clinic, in a sports clinic, in a hospital, in a nursing home, in home care. There are jobs everywhere, and the flexibility of being able to work full-time, part-time. My job in home care, I mean, if I have a patient scheduled certain days of the week, and we get a snowstorm, and I had 2 small kids at home, and a husband who had to go to the office, I could rearrange my schedule to not see them today. I'm home with the kids, and reschedule that patient. So I think the flexibility in some of the nursing work, definitely in the therapy world, has been very helpful, just for my family and for the direction I wanted to go. And obviously, like, it's just so rewarding seeing the patients and developing those relationships. So we love it.
So that's all I have prepared for questions. So now we're going to go on to if anybody out there has any questions. And then after that, you guys can talk a little bit about maybe something you didn't touch on in any of your questions, or maybe you want to explain a little bit more about what your job does specifically. So first, if there's any questions, it can be specific or...
This is for Claudia. So what specifically do you specialize in the field?
Emergency medicine. So I'm in the emergency department.
I have a question for Michael. Did you ever want to be a different type of surgeon, or was it like only colorectal?
Good question. So initially I thought I wanted to be an orthopedic surgeon just because I like sports and things. But then when I started doing it in medical school and I had some exposure, I kind of liked more of taking care of the whole patient, and that's why I went into general surgery. We really take care of our patients post-operatively. Orthopedics actually has medicine that takes care of them and things. And general surgeries are very broad, so I was able to see all sorts of bevy of different subspecialties of surgery. I saw hepatobiliary tumor surgery, pancreas surgery, trauma surgery, critical care, colorectal surgery, and I went through all those different rotations and different services, and That was the greatest thing about general surgery, that, you know, I felt comfortable, you know, operating in, you know, a significant amount of, you know, the chest, the belly. And after that, I kind of understood, you know, from my mentors and, you know, the surgeons that I trained and apprenticed under, colorectal surgery is mostly best for me. It kind of fit my personality best. Colorectal surgeons are usually, you know, they have a good personality. And, you know, we deal with a lot of things, butts and guts, so we have to be kind of good personality, so that kind of fit me better. And I'm not as high stressed at times, and, but it's definitely a great, like I said a little earlier, colorectal surgery. I do colonoscopies, I do anal rectal work, I do colon cancers, rectal cancer, inflammatory bowel disease, and it's just a good bevy of different exposure to different things, and that's why I really chose colorectal surgery. But yeah, it's about it.
So for Claudia, are you on call or do you work like 3 days a week or full time?
Yeah, so depending on what specialty you do as a PA, it depends. For me in the emergency department, I work 2 to 3 days a week. They're 12-hour shifts. And this one job, I'm not on call. We work every 2 weekends a month. So every other weekend, or sometimes if I get lucky, I get 2 weekends in a row that I'm off. I know some other EDs that I've worked at, they have had us do nighttime shifts as well, overnight shifts. This one is nice because they don't have us do that. So it's a good spot where I am right now.
Any more questions? Okay. So now, I'm just gonna go through each of you, and if you guys maybe have a little bit something extra to share, maybe I touched on a question that you now have an answer to, or anything like that. So does anyone want to start?
Let me start. Okay. So obviously I'm a nurse, so I work in the neurotrauma ICU at Hartford Hospital. So a lot of what I see is like unhelmeted motorcycle accidents. We get those, a lot of motor vehicle accidents. We get a lot of people that have had ruptured aneurysms, brain cancer, people that have had falls and they've, you know, fractured their spinal column. So sometimes people are quadriplegic, sometimes they're paraplegics. Sometimes they're really young. We've had some sad ones, like a kid diving into a pool, broke his neck, became a quadriplegic. So like some of what I see is kind of sad, but it kind of gives me a different outlook on life. It really makes you appreciate things. And I know that kind of sounds lame, but to see young people that are just living their life and then this huge event happens and their life is never going to be the same again. And obviously their family didn't know it, they didn't know it, their kids didn't know it. It allows you to appreciate what you do have when you leave the hospital. I do work night shift, so I work 7 at night to 7:30 in the morning, which I know most people probably don't think is an ideal shift. I've only ever worked nights in the 10 or 11 years I've been a nurse. I think for 6 months I worked day shift and I absolutely hated it. I worked in a PACU down in Alabama, and that was not for me. But night shift, I like it. It's quieter. There's a lot less people around. They're not trying to get your patients out of bed. There's not physicians at the bedside. Overnight in my ICU, I really only work alongside a PA or an APRN. So it feels like it's a lot more of a collaborative situation where if they tell me to do something, we can have a discussion if I don't necessarily agree with it. Whereas sometimes during the day when the physicians are there and they're rounding in the ICU, it's not as much of a collaboration, or it's not much of a discussion. You're kind of just told what to do and that's that. So on night shift you have a bit more autonomy. And then it's just, it's gonna sound terrible, but there's no family at night. It sounds so awful, but it's true. And COVID obviously changed a lot of visiting restrictions in all the hospitals throughout the state, and some of the hospitals have started to slowly go back to their old visiting ways, but back in the day they used to allow people to be at the bedside 24/7, and sometimes it's just hard to be taking care of the patient, but then to also be taking care of the family, which they are just as important as the patient because they're going through these devastating, huge life changes. But really the priority as the nurse is to be taking care of the person who is in the bed. So at night that distraction is taken away. The only negative part of my job, I would say, is the amount of travels we do. So what that means is a lot of times with head injuries, you go to CAT scans, you go to MRIs, and you know our patients are hooked up to multiple pumps, they're hooked up to a breathing tube, so you have to travel with a respiratory therapist, you have to bring the travel ventilator with you, you have to bring all your pumps and pulls with you. Sometimes they have chest tubes, so you have to bring that. We also have a lot of patients who have devices in their head that tells us like the pressure of their brain basically. They're called intracranial monitoring. So you have to bring your devices with you. We have EVDs, which are going to the ventricle of your brain and they drain CSF out, so you bring that with you. So traveling can actually be a really stressful situation if your patient's super sick, because you end up taking a lot of things and you're fitting in these small elevators, and CAT scan and MRI are not close to the unit. So if something were to happen, you're on your own. Your provider doesn't go with you, it's you and the respiratory therapist, and that's basically it. So it teaches you to critically think in a lot of different ways. And then, I mean, that's basically what I do.
So, I think a lot of times people don't know what a PA, like a physician assistant is. A lot of times they think we're the medical assistants, but I didn't know what it was until I was way into college, and my anatomy professor actually was a PA, and that's how I heard about it. And so I think to just give you guys that information is important to know what it is. I think it's, you know, many years ago, the medical field was like a nurse and a doctor, and that was it. And nowadays, modern medicine is, you have a whole team of people helping, like nursing tech, nurse assistant, like the nurse anesthetist, you have a surgeon, you have the, you know, there's so many people involved. And so as a PA, you see your patients, but you do always have your backup physician if you need, which was good for me because I never felt like I needed to, I mean, honestly, I didn't want to go into 12, 15 years of schooling, but I wanted to also be a clinician, and I like that collaborative based approach, like Kate said, you know, like at nighttime she's the nurse and then there's a PA at night. I think PAs, if you're a good PA and you have a good working relationship with your doctors, you can really lift some of that burden from them. If you worked with, you know, a surgeon or a doc in the ED for 10 years, it's like you know what the other person's thinking, and they don't even have to tell you what they need or what orders they want you to do. And they trust you, so they let you do more. And a quick story to kind of like show that is, you know, in the previous job I worked in North Carolina, we had a 17-year-old kid who was standing in the back of a truck with his friends, and he fell off, hit his head, was unconscious. It was like a traumatic arrest is what they told us was coming. And so in the community hospital where we were, I was the PA, and then the doc was in the zone that I was in. And so because I knew him and he trusted me, he said, why don't you intubate the patient? I'll see what else while I call the order. So, you know, he called the meds, I intubated the patient, he needed to put a chest tube in. And so he could kind of do more and have less mental burden as he was doing all of the things. In the background, we had the EMTs that were doing all the hooking up. The nurses didn't even have to be told what to do because they were already doing all the things. We had a pharmacist in the ED who came in and would hand the meds, epi, and all these medicines to start the resuscitation. And so that's really what modern medicine is now. And so I think for all of you that are not sure what you want to do, there's different fields, and the only real way to know what you want or what you like is to like ask questions or reach out and say, you know, have that uncomfortable conversation of like, hey, can I email you, can I shadow you to see what the heck a PA is or what a neurotrauma nurse does. And because there's a lot of rewarding careers in the medical field. And I think in 2008 when I graduated high school, I really only thought there was a nurse and a doc. And there's way more nowadays, so yeah. I don't know if that answered the question at all. I did, okay. There was a question, okay.
I can build off of that a little bit. When I was in your shoes, I had no idea what I wanted to do. I was good at math and science, and I started Googling jobs for people good at math and science. And so I ended up choosing a school that had that was a big school that had lots of options, so if I didn't like something, I could switch. And that was my mentality going into college, was that I could try different things, I could take different classes and see kind of where I thought I fit and where I didn't. And I eventually made my way to pharmacy. So it just, for me, it was a lot of trial and error, talking to different people, seeing different things, taking different classes, and learning what I liked and didn't like, and I made it out. And I'm a pharmacist.
I think that's one of the things, like, kids your age are scared of, is like finding what you don't like. You know, you don't want to go to school and kind of stumble, but it's not a straight path. Like, don't expect it to be a straight path. Go into it knowing that taking the class and realizing you absolutely hate it is as important as finding something you absolutely love, because that can point you in the right direction.
I can elaborate a little bit more on like the different career options that you have for research. So I guess what I'm doing now, I'm going to go straight into a PhD program, which takes around 5 to 6 years to complete. Afterwards, there are different options that you can have for a career. The most traditional option is becoming a professor and running your own lab and dedicating your life to a research topic that you're passionate about. Another traditional option that's becoming more popular is going into an industry job and working for a pharmaceutical company. Another option is a non-traditional, which you can work outside of the lab in patent law, which is always hiring PhDs that have knowledge in science, or also becoming a scientific writer if that's what you like to do, or just working in like a hospital setting or scientific setting, running a science program. Or there's also the option, if you're someone that's not sure if you want to do the MD route or PhD, you could do a dual MD PhD program that you can apply straight into, or you can always pursue an MD after a PhD, or likewise you can do an MD and after a PhD, or you can be a physician scientist and work with patients and do research at the same time. So those are just different options, and nowadays there's more options for careers are developing, but I think for me in the next 5 years, I'm just keeping my mind open for anything, and hopefully I'll find out what I end up doing. But
I think it's really nice for you guys to have Kate's perspective as a nurse, as a high school student, because I really didn't have that as a high school student. I really didn't fully understand their scope of practice. I feel like I thought they brought blankets and water. Like, I really didn't fully understand until I started working clinically, and really my time in the ER has opened my whole perspective to the way nurses interact with patients and other members of the team. They're educators for the patient and families, which is like really motivating for me to see. I like how they step into that role. I also like how they're like a bridge between the patient and families to the provider, like you were saying before, like you're reporting on the status of the patient, which is very important to like keep the whole team in the loop. And yeah, I think it's really nice that you were able to hear like her full scope of practice as an ICU nurse. It was really nice to hear.
Do you have any ideas, Giovanna, about what type of nursing you want to go into, or still exploring?
I'm still exploring, like I still need to go through nursing school and do clinical rotations. For me, like working in EMS, there's one specific instance, like we had a really challenging and traumatic call. It felt like the world was falling apart around you. And we had the Lifestar come in and the flight nurses come off of the helicopter, and just like their demeanor and the way they were calm, cool, and collected, and were able to like trust their training to take over patient care and not like kind of lose their cool, which for me as a new EMT, I was like, what's going on? What are we doing? And they just came in, and their demeanor really, again, was motivating for me.
Okay, so there's something else to share, or any other last minute questions? Then, yeah, Abraham.
I'm thinking for Kate or Giovanna. So when you go into nursing
Sure, so nursing school was nice because when you do clinical, they usually have you go to med surg, they have you do psych, they have you do maternity. They kind of have you go to those big 3 different places. And med surg can be on a medical telemetry floor, you could be on an ortho floor, you could be on a general surgery floor, so they're all different. And then what I did, I worked as like a CNA, PCA, like a nurse's assistant when I was in college. I worked at Hartford Hospital in the float pool, which was the best experience I had because I floated everywhere in the hospital. I went to the emergency room. The only place I didn't go was like the OR or PACU, but I went to all the different nursing units, and it gave me an idea as to what I didn't want to do. I knew I didn't want to be on like a neuro floor. I knew I didn't want to be on a medicine floor. Like that was not for me. And when I graduated nursing school, which was a long time ago, nursing was harder to get into than it is now in terms of getting a job. It was super competitive. So when I graduated, I kind of took what my first job opportunity was, which was on a general surgery floor, which I ended up loving. I stayed there for I think maybe 6 years, and then I've been in the ICU now for 7. And what's nice now about nursing, there's a lot of opportunity. You can basically go wherever you want. When I was in school, you could never get into peds. It was impossible because there were no pediatric jobs available. And now there's openings in peds, there's openings, you can go straight into the ICU as a new grad, which again, when I was a nurse was not an option. You needed at least a year of experience on the floor before you could go into the ICU. You can go into the ED as a new grad, you can go anywhere you want. So I would suggest the whole nurse's aid thing, like PCA, CNA, whatever it is, it's a really good experience to see what you like and what you don't like. And I don't think I would have found what I didn't like if I hadn't have done that. And it also kind of allows you to understand like time management, critical thinking. You might not be a nurse at the bedside, but you still have like 10 patients who need things from you, and you have to prioritize which ones are important and which ones can be done later. And that really kind of sets the foundation for being a good nurse at the bedside, because that's the same thing that happens. You have a lot of patients, they have different needs, but you need to figure out what's important for me to do now and what can I kind of do a little bit later and it won't negatively impact the patient, if that makes sense. Okay.
Gina, would you say that's the same answer for you?
Yeah, I mean, I can't really speak on going into a nursing role yet because that's not what, I'm not there yet, but I do work as a tech, which is similar to what she was saying, like a CNA, PCA type role in the pediatric emergency room at Children's. And that has really, I think, as she was saying, like it's really good to see like, and to work side by side with nurses, like as colleagues, to see like what they're doing. And yeah, it helps with time management. Yeah, it was a good experience. I recommend it if you're looking into doing it.
Liv?
I have a question for Ms. Messina. So for at-home physical therapy care, do you work with occupational therapists as well, or is that separate?
I haven't done overlap in a while, but when I started in home care, switched home care about 10 or 12 years ago, I was seeing patients who were more acute. I guess they were recently discharged from the hospital or a nursing home. So a lot of times those patients will have a nurse, a PT, an OT. Some of them would have an aide coming into the house. And I think that's the part I miss the most, because back then there was a lot of overlap with me and the OT. Sometimes we would co-treat, but there was a lot of collaboration, talking back and forth. I will say in my current home care setting, which is, it's more considered outpatient therapy, so it's patients who you would typically think would be at an outpatient clinic, but maybe for whatever reason they don't want to go to a clinic. A lot of it evolved during COVID lockdown. Patients who would normally go to a clinic, we were seeing them in the home to kind of protect them from everything out in the world. So I don't have as much team collaboration. Some of my patients may be just with PT, or some patients may have just OT, but there is a home care world where PT, OT, you may be collaborating, the nurse and I would overlap a lot, and I think that was really important. Those therapists, they become some of your best friends because you've been through it together. And that's one of the things I really liked about the short-term rehab setting and the post-op patients, like in skilled nursing. Those clinicians, the nurses, the aides, the other therapists, you can really bounce ideas off of. So I'll say in my current home care setting, not as much, but those post-op acute patients, you definitely collaborate a lot with the other therapists.
I have another question for you. So I know that it's required now to have a doctorate for PT. Have you ever thought of going back, or was that never Because you're grandfathered in, so. it's
I'm
not-
grandfathered in. When I went to school, I was actually in college when they made the transition from a bachelor's to a master's. So the classes below me had no option, they had to do the master's. My class, they did kind of a hybrid, we could do either or. So I made the decision, I think, beginning of my sophomore year, that I was gonna go through the master's program. So it literally was coming back to school for one more semester that 5th year. I've never really considered doing the doctorate. I have friends who really wanted to go into academics. So if you want to be a professor, you know, they've gone on and gotten their doctorate. I have some other friends, actually an OT I worked with. She went and got her doctorate in OT, but she's a treating clinician, but she also does some research. So I think that component was important in her education to do more research than I would have done in my master's program. And then I have other friends who are, you know, they wanted to own a clinic. And definitely you want to have all the training that you could possibly have to be able to take on that role. It was never something I wanted to do. One of my closest friends, she did an accelerated program. I think she flew out to Colorado and did it that way. I've had others that did it right here in the state. But being grandfathered in with my master's, I was perfectly content with that.
Thank you.
Okay, so any other questions? Yes.
One thing that I think would be great value in hearing from some people at the table, I was talking to my sister recently, she's a primary care physician, and she just recently transitioned from like a large corporation primary care to her own private practice. And a huge reason behind that was like work-life balance. And that worked for her and her family, and my nephew and my niece. So, you know, as you guys are finding your career paths, you're also finding your life paths, and you're gonna maybe get married or maybe start a family. And I'd love to just hear from a couple of professions about like how is that work-life balance within the field, medical field in general, and also within your specialty, so that you know, you can kind of make it work while also still living your life and family and all that, and you know, coaching a soccer team here and all that stuff.
I mean, that's why I loved what I've done. I mean, you all know me as like the volunteer who's here, like serving pizza or in the classroom or whatever. So when my kids were, I worked full-time for a bit, and then when my kids were small, we made the transition. It worked perfectly. I kind of job shared with another PT. One of us was working 3 days, the other was working 2 days, and we were in an environment where our boss was very open to that sort of job sharing, and it worked out so well. She would be there on Monday, give me a call, give me the lowdown on our patients. I would be there treating on Tuesday, and I think that is still available. I think at least in the physical therapy world, I know people who work full-time, part-time, and a lot of the jobs are shifting. You know, maybe you work mornings, and then there's a rotation where you might work weekends or like a Tuesday through Saturday. There's so much flexibility, I know, in PT, OT, that really, you could find what works for you and your families, or, you know, you're not there yet, but someday that's something I want to think about.
In medical training, there actually is a work hour restrictions now. For surgery, it's 80 hours a week, and it's for the bevy of other parts of medicine. They have kind of, you know, different lifestyles and things like that. So surgery's one, medicine's a different. People go into OB and things to that degree, and all residencies are very different in terms of how much difficulty in terms of the work hour balance. And so if you don't want to become a surgeon, there's other bevies of medicine that you can get into: primary care, family medicine, and those residencies are different in terms of how difficult in terms of time and having a good work-life balance. But for surgery, residency was definitely difficult, and there was definitely family was on hold for most of that and things like that. But now there's a lot better in terms of work-life balance, and medicine's understanding that it's important to be a well-balanced individual and to have good life outside of medicine. In addition, it just makes you a better physician caring for the patients and things like that. So there's all sorts of restrictions now in terms of, you know, getting the appropriate time off in between to have your own mental health, and so you can't work more than 24 hours at a time, and you have to be off for 12 hours after a 24-hour shift, and there's an 80-hour work week. So it's definitely better, and it's probably safer in terms of taking care of patients for you and for the patients. So it's definitely a better work-life balance. So definitely all become a surgeon.
That is all I have, and if there's no more questions, then I would just like to thank you guys all for being here. I enjoyed learning about all you guys' different careers, and especially how a lot of people left too. I think that was like kind of thing. So yeah, if there's no further questions, then